up your meeting for Facebook Live.
Okay, we are
Alright.
now live. Hold on, let's just see. All right.
Okay.
So, hi,
Hi.
Assalamualaikum.
Waalaikumsalam, Nani.
Bismillahirrahmanirrahim. Baru baca bismillah lepas bagi salam.
Amin.
Very good morning. First, Doktor, kita tunggu dulu. We just give like 1 minute to just let everyone to start coming in and join our live. To those of you who have just joined us, you are now tuning into MAA Medicare Cardiac Diagnostic Center Go Live with Doctor. Today is our very first live session actually, and we're quite excited. Are you excited, Doctor?
I'm excited, nervous.
Okay. All right. So for those of you who have just joined, thank you so very much for joining in, for tuning in. And please don't forget, we want to have a lot of people joining in and watching our live session today because we will be talking about COVID-19 and heart diseases. So please share this live session because you can stand a chance to win a deluxe healthcare package worth RM290. So share. Jika anda merasakan live session ini akan memberikan manfaat kepada diri anda sendiri atau sanak saudara atau rakan-rakan, so share in your Facebook as much as possible lah. Okay, so before we begin, allow me to just give you an introduction of who we are actually, MAA Medicare. For those of you who just tune in, kalau yang tak pernah dengar mengenai kami, anda boleh tekan share. Kalau yang pernah dengar, silalah, you can leave any comments or click the thumbs up, click like button. Okay, so let me just briefly introduce to all of you tuning in right now. MEA Medicare Cardiac Diagnostic Center is Malaysia's first charitable cardiac diagnostic center, and it is established in 2018. Now, it is set up to provide high quality cardiac treatment at affordable prices for underprivileged Malaysian, or it is based on the socio-economic background with highly subsidized rates. Okay, and we are located at Jalan Ipoh, but now it is known as Jalan Sultan Azlan Shah, Kuala Lumpur. Okay, so again, share this live and also if you can see in the comment section, there's our phone number. You can reach us via WhatsApp or call us to book your slot because we are giving out free screening to get your blood pressure, your glucose, and your urine test done at no cost at all. So contact us, look for our number down below. Okay, habis dah introduction. And now, let's begin our live session. We'll be talking about COVID-19 and heart diseases. Let me introduce you to our panel today. It is Dr. Nick Muhammad Adzrul Arif, who is the Resident Medical Officer, MAA Medicare Cardiac Diagnostic Center. Assalamualaikum, Doctor.
Waalaikumsalam, Nani. Hi, everyone.
Okay, Dr. Nick, thank you so much. Oh, thank you for being with us here today for our live. Okay, Doctor, I guess this topic is high time we discuss about this last about our COVID cases is getting higher day by day, so it's high time we talk about this. And first and foremost, maybe Doctor, you can explain to all of the viewers now watching what is actually cardiovascular disease, Doctor.
All right, okay. Cardiovascular disease. I think to make it easier to explain, I have a model of the heart.
Great.
Okay. So basically, cardiovascular is two systems. The heart. Cardio means the heart.
Okay.
And also vascular means the blood vessel inside the heart. So cardiovascular basically is the disease of the heart and vessel.
I see. Okay. So do people with heart condition, are they more at risk getting COVID-19 than somebody who doesn't have a heart condition, Doctor?
I think because COVID-19 is more of a virus infection, and now they are saying it's an airborne disease. So anyone can actually get COVID-19 regardless of whether they have heart condition or not. So everyone is at risk actually. COVID doesn't discriminate basically.
Right. So it doesn't matter lah if you have heart condition ke, you are heart patient ke, you're not heart patient ke, your
Yeah,
age kan. Last time
it's
people
more
used
on
to think,
exposure.
right. Because last time people used to think like, oh, you have heart problems, you might get contracted COVID-19, but actually no, doctor?
Anyone can get it actually. It's just that if you have a heart condition, then there's some added risk lah for those.
Right. Okay, so what about developing severe symptoms? Is it the same to all, or if you have heart complication or condition, are there the differences, doctor?
All right, okay. Based on the first the earlier question that we got, anyone can get COVID, and it depends on the stages of COVID-19 that we contracted. So there are people with no heart condition or there's no disease at all. Tapi when they get COVID, they develop it into stage 4, stage 5, and even though they have no heart condition, and there are some heart patients who contracted COVID, but they just remain at stage 1 and stage 2. So it's actually depends on COVID, the stages of COVID in infection that they contracted instead of the condition of the heart. But of course, if the heart disease itself is not being treated, adequately. Say they have cholesterol condition, they have a blood pressure condition, they have a pre-existing heart condition, and it's not being treated. They are not on medication. They don't do screenings. So these might aggravate their overall condition if they contracted COVID-19.
Right. So how about for heart patients? Can they take vaccine? This is also a controversial question, because they think like, oh, I have a heart problems. I don't think I can take the vaccination shots because there's so many adverse side effects. So macam mana, doctor?
Okay, actually the general recommendation is that everyone can take vaccines, even heart patients. Actually, it's even more encouraged for those who have heart conditions or even any chronic diseases to take vaccines, because like I mentioned, if they have a pre-existing condition, like a heart condition, and they contracted COVID, they are exposed to COVID-19 virus. So their overall health system can be worse,
right?
Compared to those who have a heart condition, but everything is in check. They do regular screening, they take medications adequately. So if they get COVID-19, the risk is a bit less. For vaccination, for those who have received vaccination so far as the reports go, if they contracted COVID, they didn't really end up in severe stages like stage 4, stage 5. Maybe they'll just be quarantined inside their houses.
So it applies to tak kisah lah if you have heart disease ke apa ke, it's better to take vaccination. Tapi doktor ada juga yang tanya for those heart patients, if they are taking medication like heart medication for their heart kan, so can they will there be any adverse side effects if they take the vaccine? Because I've heard before people say, oh, dah ambil vaksin kena palpitation, they get things like that. So what more for heart patients, doctor?
Okay, all right. So heart patients, medication and vaccination, the questions. So no, there's nothing being released saying that those who are on heart medication cannot take vaccination. They can do so. Take the medicine as usual. And about the side effects, it's more or less how the body responds to the immunization. Let's say one person can get the vaccine and have no symptoms at all, whereas the other patient might get the vaccine and have that fever, body pain, heart racing. But heart racing is actually not a common reported symptoms compared to fever, body pain, drowsiness. These are the more common symptoms lah. And if in regards to palpitations, any suspicions that related to the heart, like chest pain, heart racing, these are very uncommon. So if this happens, please check with the nearby doctor lah.
Right. And just rule out unnecessary things lah.
Yes, because usually the more common symptoms like fever, cough, and cold, body pain, drowsiness, just you can rest at home lah.
Right. Okay. Doctor, people, we always think that COVID-19 is a disease that involves the lungs because, it involves difficulty in breathing and whatnot. But I think the recent research, they have said that COVID-19 can actually damage the heart, and people who have had contracted with COVID-19 have apparently reported that it is similar to when they get heart attack because it damages the heart. So how far is this true, doctor?
Okay, COVID-19 actually, the method of entry is from the air. They entered through our nostril and mouth into the lungs, and then from there they can actually go to the blood vessels, which created this side complications on other organs. COVID-19 is actually quite known to cause increased risk of blockage in the vessels, in the vessel. So if the blockage happens at the heart, for example, so use a heart attack.
Right.
So there's an increased risk of vessel blockage for COVID-19. It's been reported.
Okay.
So then there's hospitalization cases for those having severe COVID-19. They do give medication to help reduce the risk of blood blockage, blood vessel blockage.
So it's due to the blood vessel blockage from the COVID-19, which will cause, let's say, a COVID-19 survivor becoming a heart patient after recovering from COVID-19.
It's more during the process of infection. Let's say they are hospitalized during the active phase of infection while they are still basically in a danger zone. They've contracted COVID, and instead of the virus just sticking to the lung, it goes to the blood vessel and cause other organs damage. This is usually who are in stage 4 to stage 5. They are going to experience these multi-organ complications, and it can last even if let's say they actually recovered, but the damages are there. So after the initial process of infection, being warded, and after discharge, they do need medical attention as a follow-up to see whether there's any lasting damages or whether it can be mitigated by medications or other treatments.
Right. So it's really a scary thought.
Yeah. Usually stage 4, stage 5 is getting scarier compared to those stage 1, stage 2.
Right.
Yeah.
So get vaccinated.
Yeah. It reduces the risk, although it doesn't stop you from getting COVID, but it reduces the risk of complications, reduces the risk of the disease being in the advanced stage if let's say we contract it.
Right. So what we don't want is, getting COVID is one thing lah, but what we don't want is to get into the stage of 4 and 5, that stage lah. So that is what we do not want. Okay. So doctor, another question is also a sensational. Also, tak adalah sensational, but people are always, lah, now we're in the pandemic, so it's always the fear mongering things are going on, so people say like people with heart diseases are more likely to die of COVID-19 and those without. So how is that true, doctor?
All right. Okay. People of heart disease. Okay. It goes back to the stages of COVID-19 that we've, let's say a person contracted COVID-19 and they also happen to have a heart disease. So it depends on the stages as well. Stage 1 and stage 2, the risk is less. Stage 5, the risk is there, especially if the pre-existing heart condition is not being taken care of well. So it's actually quite the same. For those who have not had any heart disease being diagnosed also, if they advance to stage 4, stage 5, they also have that risk of death.
Like you said lah, doctor, COVID
Uh,
doesn't discriminate.
yeah,
So,
so, but of course, in between two people, one is completely healthy but got
yeah,
COVID-19 stage 5,
yeah.
and one with a heart condition having stage 5 COVID-19. So the one with the heart disease has a
Most
higher risk.
likely lah. I see,
Uh,
I see, I see. But you know, a healthy person pun still have the risk juga lah kan, if they are
ada.
contracted for
Yes.
level apa? 4 and 5. Okay, to those of you who have just tuned in, let me just reset the room for a while, Doctor. For those of you who have just joined in our live, welcome and thank you so much for tuning in. This is MAA Medicare Go Live with Doctor, and today we're talking about COVID-19 and heart diseases. So if you just join in, please share this live session. If you think it will benefit you and your friends and your family members who are perhaps heart patients or want to get themselves checked in terms of cardiovascular diseases, please share, because we are currently having this sort of like a competition, I must say, but the administrator will pick one winner. So share this live and maybe you stand a chance to win a deluxe healthcare package worth 290 ringgit. And for those of you who have just tuned in, MAA Medicare Cardiac Diagnostic Center, we are the very first charitable cardiac diagnostic center, and it is a 12 bedded facility providing 10 types of cardiac health screening and complementary services. Yang tu nanti kita tanya doktor akan explain what are the services provided by MAA Medicare Cardiac Diagnostic Center. And we are located at Jalan Ipoh, but now it's known as Jalan Sultan Azlan Shah, Kuala Lumpur. So if you're staying nearby in KL and perhaps that you know, you have friends and relatives yang want to get themselves health screen, check, blood test, checkup, you can contact us. Our number is in the comment section down below. Please contact us, book your appointment, and you can get complimentary or free screening for your blood pressure, glucose, urine test at no cost at all. Okay, so we have people coming in right now. Hi, Assalamualaikum semua. Selamat join of our live. Okay, so doctor, getting back into our discussion for COVID-19 and heart diseases. Okay, so for example, for heart patient, are there any additional measures that they can take so they can limit their risk for getting sick?
Okay, heart patient, how they going to limit the risk? I think the prevailing SOP sekarang ni macam washing your hands, social distancing, wearing mask, these are all applicable for heart patient as well. But on top of that, they have to really make sure that their heart is in the they have proper follow up for the heart conditions. Say they have appointments already with the cardiologist, and please speak to the cardiologist and see if their medications are in order, or whether the medications of the medicines, blood tests, basically proper of their current illness lah. Otherwise they still need to maintain the SOP, and of course vaccination.
Right.
Vaccination. If they already have their appointment for vaccination, please do so. I think that if they are already with heart disease, they already under care of specialist, the specialist will not object of them getting the vaccination. In fact, they will encourage the vaccination.
Yeah, correct. Yeah, so no problem makan ubat jantung pun boleh
tak
je.
Ada.
Pergi cucut, tak ada masalah.
Tak ada masalah.
Okay, so doctor, how so for example, if a heart patient, they are infected with COVID-19, so how do they manage the heart condition? Macam mana nak jaga jantung tu?
Okay, alright. Okay lah. So the initial process infected stage lah, the first 10 to 14 days ni, of course, so the national recommendation lah, quarantine, whether at home or at hospital. Medication still take as usual. If they have blood pressure medication, diabetic medication, cholesterol medication, semua sambung makan macam biasa juga. Cuma follow up usually of course because they are still infective stage, usually they can postpone the follow up until the stage when they are no longer infective. And if they already got the appointment for vaccination pun, they can postpone it until they are out of the infective stage. But otherwise, while they are still quarantined, makan je ubat macam biasa. And then self-care, I think aside from physical medication, of course the mental health issue pun kena jaga juga. I mean, if they are really worried or anxious or scared, please just reach out to someone to talk to. I mean, the doctors, they can actually call their doctors and speak to them on how to actually care for this heart condition during this worrying time. I think nowadays with the advent of telemedicine, I think banyak doctors pun they are open to this teleconsultation, provided that they already been seen before.
Right. So that's another option. They can just one
out.
phone call away lah, reach out.
Because yelah macam heart condition ni can be different. Some people may have previous heart attack, some people may have history of bypass, some people have irregular heart rate. Semua ni they have different kind of management. So the general rule is to continue the medication, to continue the SOP, but then they still need to talk to their doctors to really fine tune the management juga.
All right. Okay, doctor. So having said that, can you explain to us more what does MAA Medicare Cardiac Diagnostic Center do?
Okay, MA Medicare Cardiac Diagnostic Center ni, it was established in September 2018, but a bit of history behind the establishment of MA Medicare. It actually started out as a charity dialysis center back in 1994. So from one center, also in Jalan Ipoh, throughout these 25 years, they expanded to another 11 centers nationwide, Sabah, Sarawak, Kelantan, Penang, Johor Bahru, Selangor, KL, semua. So after the success of this charity model for dialysis, so they began thinking to extend this kind of charity model also for heart patients. Right. Because statistically every year the number one death cases in Malaysia or even worldwide is actually heart conditions. So they wanted to do the same for heart patients. After seeing that back in 2014, they saw that most people who are waiting for government treatment, they have to wait for a few months to get this follow-up done. And then in private, some may not be able to afford private care.
That's right.
So some may not qualify for medical card or insurance. So what will happen to these people? Basically cannot wait long to see a doctor in government, cannot afford the
private.
So for this awkward middle group, so this is MA Medicare Cardiac Center is all about lah, to cater for them. Basically we provide the treatments and diagnostic and treatment at a much reduced cost, basically subsidize the cost. So because MA Medicare initially with dialysis and now cardiac, we receive donations for those who are supportive of our cause. So from we are able to provide this subsidized care. So once established in 2018, we are a center, like you said, gadget center with a cath lab, with a radiology department. We offer services like blood tests, ECG. ECG is basically the one that you can see in the regular clinics as well. You go there, have the heart check, and then the doctor will explain the condition. So that's ECG, and then there's also some advanced cardiac screening like echocardiogram. So echocardiogram basically is ultrasound, similar to antenatal ultrasound, but they are more for the heart. So from echo, the ultrasound can actually detect whether the heart is enlarged or not, whether it's pumping irregularly or not, whether there's any abnormality in the blood flow. So these are one of the few functions of the echocardiogram. And then there's a test. So it's like ECG, but you are taking the ECG while running on the treadmill.
Right.
Yeah, this is actually to mimic a condition where a person has a heart attack.
I see.
Yeah,
So
kalau
how can the
ECG,
heart take lah?
basically
So how
kalau
much can the heart take?
ECG,
Okay.
the normal ECG in clinic,
Mm-mm.
they are detecting what's the heart like
During
during
rest.
resting.
I
Yeah,
see. Yeah.
and
Right,
then
right, right.
they stress test while you are running, so the
Right,
heart
right.
will see how's the condition of the heart. So from there we can actually see whether there's any suspicious of blockage or not. So from there we can escalate the procedure more to let's say CT coronary angiogram, or even the invasive angiogram, coronary angiogram. Basically, what they are doing is to insert a catheter, which is more or less like a wire lah kan, masuk dekat blood vessel, the heart, and a series of X-ray will capture the heart. So from there we know, ada block, one vessel block, two vessels block, three vessels block. So from there we can escalate. Nak masuk stent ke, nak bypass.
So these procedures are also can be done at the
We
center
can,
ke? I
we
see.
can do it here. Cuma the difference between us and private hospital, we cannot take emergency. So those stable cases, those we diagnose during clinic procedures, we can do the angiogram here. But in hospital, they have another advantage because if let's say a person has a heart attack, immediately goes to the emergency, they can straight away push it. For us, our limitation is the stable diagnostic.
So not for emergency cases
Not
lah.
for emergency cases.
Right.
But we have
yes, doctor.
so and then we have a radiology department with X-ray and CT scan. So that's about it. Those are the services that we provide.
Right. But quite state of the art juga lah, doctor. I mean, it's quite banyak juga lah the services, and then for a subsidized rate, it's
it goes back to the intro that you gave. We wanted to provide a high quality treatment for the patient. So just because it's cheaper, subsidized, doesn't mean it have to sacrifice quality, kan?
Yes, betul.
So we wanted to make sure that everyone who came here, they are satisfied, they're happy with the procedures taken, and then the prices, and then also the consultation with our doctors. Our doctors are from other private hospitals. They come here with the intention to also support the charitable cause. So
sort of like a CSR lah for them as well.
Yes, they are coming from top hospitals juga, Grand
Oh, great.
or Avicenna. So they're willing to come here and spend some time to see our patients as well.
Okay, Dr. Nick, thank you so very much. Unfortunately, we just have a few minutes left for our live session. So again, maybe you can briefly, just any pesanan-pesanan kepada viewers kita for today that you would like to conclude for today's session, Doctor.
All right. Okay. Thank you for tuning in. Thank you for having me at sini. So I think the general pesanan, as Nani said, during this trying time, during this pandemic, is if you have the appointment, you have the opportunity, you have no contraindication to get vaccinated, please do so and help us increase the herd immunity. And then if you have heart diseases, please take care. Nowadays, the cases of heart attacks are getting younger and younger. I think we've heard of news of a person in their late 20s or 30s yang also dah kena heart attack previously.
Yeah, betul.
Previously we heard about these cases in those who are at their advanced age, like 50, 40, and 50. So please do take care of the heart as well. Take care of your diet. If you exercise is a bit difficult, I think, during this pandemic, but still,
manage stress lah kot kan, doctor. Stress lah sekarang pandemic.
I think stress also. I think the mental health advocates are getting more and more right now. I think it's easy to reach them for support, for help. So take care of your physical, mental health, heart health, so that hopefully we all can weather through this pandemic until everything is back to the new normal.
Yes, we hope so too. So, thank you so much, Dr. Nick, for that very thorough explanation. So we hope there's a lot more questions actually to cover COVID-19 and heart diseases, tapi itulah kita masih tak sempat. Whatever it is, thank you so much for tuning in. So we will have a dedicated posting kejap lagi because our admin will select the winner of the deluxe healthcare package worth 290. So walaupun tak tahu siapa pun menang, tapi kita congratulate lah, siap-siap congratulations for winning the deluxe healthcare package. And thank you so much for tuning in and for sharing this live. And this live will be made available after this, so you can keep on sharing the video, no worries. And also do take care and thank you so much. And we will have another live session next Friday. So do tune in and stay tuned for our postings to see another episode of Go Live with Doctor with MAA Medicare. Thank you so much. My name is Nani Roslan and thank you, Dr. Nick. So take care, everyone.
Thank you.
Have a great weekend ahead. Assalamualaikum and bye-bye.
Assalam. Bye.